I have this thing that happens every once in a while in our practice, and I thought I'd ask you about this. We schedule a euthanasia. It's on a 4-year-old Labrador Retriever. Dog's in the office. He looks all right, and the clients, and lots of times it's their first time in our office, and I think that happens every once in a while. People will have a regular veterinarian, and they've gone through, and they don't want to go back to that practice to have their dog euthanized. They bring him into me to have me euthanize him, and then our exam room technicians will take him in the room and put him in there and get everything ready, and then they come out and they start poking me in the arm. They're going to put a perfectly good dog to sleep in there. There's nothing wrong with that dog. I petted him, everything, yada yada yada, and I know there's more to it than this. They're not just very few people nowadays euthanize a pet for no good reason whatsoever. And I don't know exactly how to go about handling this. They want me to talk to them and find out, and I do. I mean, I try to find out what the history on this dog is. But in the same breath, I have some concerns about if I take that dog and talk them out of not euthanizing it. If it's a dog that has like an on and off switch, it's a dangerous dog in their household with them, good 1 minute, bad the next. I think clients really struggle with this, and I don't know what is exactly is a veterinarian's responsibility when you get one of these dogs in the room and you've got the stuff out and you're ready to do it. I don't want to have to entertain questions after the euthanasia is all over. Do you think there was anything else we could have done? I mean, that's a horrible time to have a question like that appear. If you were in my shoes performing one of those procedures today, how would you handle that?
Well, I think you have some responsibility to the pet, no doubt about it, and certainly responsibility to the family, no doubt about it. And if you can help the pet, help the family without euthanizing that pet, and arguably euthanasias for behavioral reasons are probably pretty high on the list for shelters and often high on the list for veterinarians. A study a couple of years ago showed that maybe 250,000 pets euthanized at veterinary clinics were for behavioral reasons. So it happens. The problem is that you also have to balance that against safety. And behaviorists, one of the main things they do, and now we're specifically talking about aggression, and there are other reasons they might be in there. It could be a pet who's messing their house and destroying it, and I'm going to be a little bit more on the pet side in those situations. But when there's safety to the public, safety to the family, safety to the pet itself, then we have to weigh everything that's going on. And veterinary behaviorists do prognosis. We try and determine if there's something that can be done for the pet, if there's something that can be done for the relationship, if the risk is high, if the risk is low. There are many things such as predictability, the type of family, the size of the pet itself, like a big dog versus a small dog. Sometimes breed is a factor. And when you put all that together, sometimes they just need some instructions. Mm-hmm. Sometimes they just need a different home for that pet, but it's going to work out. And sometimes, unless they're committed to doing it, there is nothing that's going to be done to ensure safety, and therefore we do have to go through that option. But that takes time, so that sometimes you just have to be pretty adamant, refuse to do it right now until they think about it, seek out the options of going to a behaviorist, seek out the options of getting some advice and some history taken from you and your staff. And if you think it can work out, try and give them those options. If not, I guess safety comes first. Now, when you get into other problems like a house soiling pet, a separation anxiety pet, a pet with fears and phobias, some of the other behavior problems, that's sometimes more anxiety of the pet, which we can help perhaps with drugs. It might be a bond issue. It might be an issue where they just don't care for the pet the way they would because the behavior is not what they want it to be. And in those cases where there's no injury or danger factor, if we think there's something we can do for the pet, I think we should be siding on the side of the pet and trying to say, you might not be the right home, you might be the right home, there are things that can be done. A lot of people don't know there are options.
So, but if I explain to that and they know their options and we proceed on with it, I mean, that's always the part I hate, that cold shoulder from my staff after I do that, because I think it takes an awful lot of thought prior to coming into these things. I mean, and they're always putting on a reasonably decent face when they come in. It never lasts very long once we get started on it, and I think I think this happens to veterinarians almost I think it happens to every veterinarian every year. And
it does, but I think that each state Practice Act gives you different obligations and requirements. And in some cases, once you accept that person as a patient, at least in the province of Ontario where I work, then the client's wishes, if they're the appropriate ones under the circumstances, have to be met. That's why sometimes the screening of these cases, if you don't want to do them, is at the level of reception. In other words, when those phone calls come in, are you a client of our practice? No. Is your pet sick or ill? No. Then this isn't a procedure that we do electively. But if you do want options, please come in and we'll talk to you about your options. I know somebody will eventually do it, but at least morally you can feel a lot better that you didn't. So if it's not something you want to do, I think unless it's your own client, you just don't offer elective euthanasia. If it's something you're willing to do, at least get them in and give them their options.
Yeah, I think I really think the one reason they sometimes will come to us to do this, they want to keep their other veterinarian, but they don't want to have the bad memory going in that hospital.
Oh, for sure.
Yeah.